Well, I'm delighted to stand with my colleagues here today who are truly committed to making a difference when it comes to how we approach wellness. And you've outlined so dramatically, I think, for us the changes that we're seeing in this country when it comes to our obesity rates. And as we debate healthcare reform and how we move forward with changes, our reality is we can do a lot of things on paper. We can do a lot of policies. But if people, for a multitude of different reasons, don't kind of take charge and be wise consumers when it comes to what they're putting into their bodies, whether it's the healthy foods or whether they're choosing tobacco products, which are known killer, we can do all the healthcare reform that we want. So much of what we've done with this compromise is to help with the educational effort, the awareness. If you don't know that what you're eating is not necessarily good for you, or these are just empty calories, you're not really thinking about it. What you're doing is you're responding to the impulse that says, I'm hungry. I was looking at your chart, and if you look at where your data starts, there was a time when we all ate a lot more of our dinners, a lot more of our meals at home. Mm-hmm. Mom, this was the stereotype at the time, Mom made a dinner, and you had a vegetable there that she got at the store, and you had a salad, and you had your starches and your dairy product, and you had a well-balanced meal, and you kind of knew where everything came from. Our world, fast forward to today and your statistics, our world is so much faster. And we're not sitting down at a dinner table where Mom has prepared the full-on meal because, you know what, Mom's working a job and Dad's working a job, and the kids are coming from all different quarters, coming from soccer and wherever. And our life is faster. So what we've got to make sure is that we're providing the information and the tools so that we can be wise about what we are eating. When we do stop as a family at that restaurant, even if it's a fast food restaurant, even if it's a sit-down restaurant, that we know what it is that we are consuming. So as we talk about the merits of what we have advanced, I think it is important to recognize that there was quite a compromise coming from the different perspectives from the bills that were out there. But I think the reason that we're standing here today is we all agreed on what the goal was. Mm-hmm. The goal was getting towards a healthier America, reducing our obesity rates, really working towards wellness. So if the goal's the same, by golly, we're going to figure out a way to make it happen. Mm-hmm. I just came from a meeting with some folks within the restaurant industry that are absolutely ecstatic today over this news. And one of the reasons from their perspective is, thank you for making our world easier when it comes to printing our menus. Mm-hmm. They have chains in all states but Alaska. We're going to work on that one. And they recognize that they're dealing with 13 different states and 13 different requirements in terms of what must be on that menu. They're looking for some assistance when there's a uniformity of standards. This compromise has dealt with that. Senator Harkin, you and I have worked very hard on the effort to update the nutritional standards within our schools. Yeah. And we're making great headway on that. And one of these days we're going to be at another press conference announcing the good news there. Mm-hmm. But bit by bit, we are gaining in our educational effort to make consumers better understand what they're putting into their bodies and how they can take charge of their own health care and thus reduce their costs and have a happier, healthier lifestyle. So I'm delighted to be with you. And I do want to make sure that we have recognized, and Senator Carper, you mentioned the Coalition for Responsible Nutrition Information, National Restaurant Association, Center for Science in the Public Interest. Very important that we were able to work with all these entities to make this happen. Thank you.
Thank you, Lisa.